Hello, and welcome to Health and Wellness Oklahoma. I'm your host, Rick Heath, and with us today, Dr. J. Arden Blough, Medical Director of Optima Weight and Wellness in Edmond. Dr. Blough, thank you for being on today.
Oh, you're very welcome. It's a pleasure to be here.
Dr. Blough, talk to us about your medical background.
Well, when I first started my medical career, I worked in the emergency room. Then I opened a family practice and did primary care for a number of years, went into pain management, and finally began in bariatric medicine, which is weight loss and hormone replacement for both men and for women. And that part of my medical career is the most exciting, rewarding part because I spent most of my medical career treating disease. And now I feel like I'm finally ahead of the curve preventing disease.
And talking about and talking to people about wellness and how they can be, have that more in their life.
Absolutely. And one of the primary things that I see in my practice is people with thyroid problems. And it is such an important hormone because it causes so many problems if it is not optimal at optimal levels.
Now, optimal levels can be varied, but there's a way that we can talk about how that can be done. But before we do that, what are some of the symptoms that people might display?
Well, the primary things that I see people with thyroid problems, of course, they have fatigue, they have weight gain. Other things can be dry, brittle hair, nails, skin. They can have some depression because thyroid regulates the metabolic process that control all of those things. Digestive problems, sex drive, almost every cell in your body is controlled by your thyroid.
Well, and we can talk more about that on Health and Wellness Oklahoma in just a moment. We'll take a short time out and be back with Dr. Arden Blough of Optima Weight and Wellness. Welcome back to Health and Wellness Oklahoma. Rick Heath with Dr. J. Arden Blough of Optima Weight and Wellness. Dr. Blough, we talked about thyroid problems and some of the symptoms. Let's talk about some of the symptoms in a little bit more detail so the viewers out there might know how it might affect them.
Sure. One of the major things that I see is fatigue. And because thyroid controls the metabolic rate of your body, I see people who tell me that they just don't feel like they can get going when they get out of bed in the morning. They've gotten a good night's rest, but they don't have the energy to go out and do some of the things that they need to do, work, pleasure activities, and so forth. That also causes a secondary problem because if they're not getting enjoyment out of life, then they can become depressed. And thyroid has the effect both directly and indirectly on mood and some depression. Now, other things that thyroid can lead to, low thyroid levels can lead to, are weight gain. Again, it's a control hormone, so it regulates your metabolic rate. If your metabolic rate is slow and you don't have the energy to do things, you're not burning as many calories as you normally would, either when you're active or when you're not active, and so that leads to weight gain. And one of the major problems with weight gain as people become older is that it can lead to diabetes. And we see many people who have problems with their blood sugars, but also have this underlying problem with their thyroid that had a causative role in it. And nobody wants to become a diabetic. There's lots of problems with that. The other problems that I see people for are they may have hair loss. Thyroid controls the rate at which we replace rapidly dividing cells like hair, skin, and nails. And so I see lots of women come in that they have to go to the nail salon all the time because their own nails are very thin and brittle. The digestive problems. Thyroid controls the rate at which you digest your food. And so we see problems like constipation or poor appetite with thyroid as well.
Now, you mentioned quality of life. It affects the quality of life. If you have a thyroid problem, it can affect drastically your quality of life, and you've mentioned those. Does it have an effect on the sex drive also?
Absolutely. People don't, both a direct effect and indirect effect. If people don't feel good about themselves, they're not going to feel sexy. They're not going to feel like they're desirable people. And not only that, if they don't have the energy, they don't feel like they have the libido or desire to participate in sex either.
So that's more, that could be part of the symptoms. The one also about quality of life, you know, if you've had a good night's rest and you're still feeling tired when you wake up, that's got to be a foretelling of a problem with something in your body, and it could be a thyroid.
Yes, it can. And again, it's very easily checked. I do check all the major thyroid hormones, and we can restore those not just to normal levels. It's my opinion that they need to be at optimal levels to maximize the performance of the thyroid in order to get people to be able to live a happy, a fulfilled, active life.
And we're talking about happy, fulfilled, active life here with Dr. J. Arden Blough of the Optima Weight and Wellness in Edmond. We'll be right back on Health and Wellness right after this. Welcome back to Health and Wellness Oklahoma. Rick Heath with Dr. J. Arden Blough of Optima Weight and Wellness in Edmond. Dr. Blough, we talked about the symptoms and some of the problems that a thyroid presents. Let's talk about the good news. There is good news if you have a thyroid problem.
Yes, there is, and it's relatively simple to correct in most people. First of all, let me tell you, the viewers, where your thyroid is. It's located right here at the base of your neck, and you have three major thyroid hormones. You have TSH, that comes from up here in the pituitary up in your brain, and that's a regulatory hormone. All it does is tells your thyroid to produce more or less of the second hormone, T4. Now, our bodies use a little bit of T4, but not much, and so what our body has to do, it has to convert that T4 into T3. And so I see many people that have had their TSH and or their T4 levels checked, and they look okay, but they're not very efficient converters anymore of T4 to T3. And T3, remember, is that hormone that the body uses to control the metabolic rate of all the cells in the body. And so I also see people that come in, they're on a thyroid medication, but they don't feel any better. And many times it's because they're taking a medication that all it has is in T4. And so if it's just got the T4 in it and they're not converting, it doesn't help them that much. One of the common names of those medications is Thyroid or levothyroxine. And so by putting them on a little bit different medication, I get much better results than using the Thyroid or the levothyroxine. And we monitor it with blood tests. I have many people that cannot believe how much better they feel once they get their thyroid regulated.
You know, and it's easy to do. You said it's just a simple blood test.
Yes, it is, and it's oral medication. It's not shots or infusions or anything like that you have to do. For most people, it's just a pill that you take first thing in the morning, right before you take your shower or after you take your shower.
So, Dr. Blough, these people, with a simple test, they can find their optimal levels for their thyroid through these tests.
And I'm so glad you talked about optimal levels and not normal levels. There's a huge difference. For example, when I look at free T3, that's that most important thyroid hormone, the range goes from 2.0 to 4.4 for a particular lab. Normal then, if somebody's at 2.1, they're, quote, normal. If they're at 4.3, they're normal. Who do you think does better?
Well, yeah, obviously there's a difference.
There's a huge difference. And I like to think of it this way. In the top end of that range, that 4.0 to 4.4 range, that's the optimal range. That's the A range. Then you go down to the B range, C range, D range. I mean, it's a no-brainer. Where do you want to be? Do you want to be up here in the fours, or do you want to be down here in the twos?
So it's a simple process. It's just get those optimal levels up through these tests and through medication, and you can raise that, help that thyroid problem with these people and get their overall health up.
That's correct. It is something that we need to continue to treat. There are conditions that we cure, there are conditions that we treat, and this is one that we treat, which means it's ongoing medication.
Ongoing medication, and it's simple to do. You just come into Optima Weight and Wellness, get a simple test, find out where your levels are, and then you guys can medicate them. And from that point, they can, with proper supervision, regain their wellness.
Absolutely, and I love having people tell me that that their lives are better, they have more energy, they're losing weight, their sex life is better, their mood is better. It is such a rewarding part of my practice.
Well, it's got to be rewarding to help people regain their wellness. We're talking with Dr. J. Arden Blough of Optima Weight and Wellness in Edmond. For more information, give them a call at 715-1919. That's all for Health and Wellness Oklahoma. We'll see you next time on Health and Wellness Oklahoma.